Analysis of data has found the people most at risk of finding themselves entrenched long-term are young carers, young parents and some students. The government's inviting stakeholders to pitch new and novel ideas to give people a leg up into employment, training or education. To talk about some of the possibilities and pitfalls of a new approach, I'm joined now by the CEO of Carers Australia, Cresswell in Canberra, in Adelaide, Terese Edwards from the National Council of Single Mothers, and in Sydney, the CEO of Mission Australia, Catherine Yeomans. Welcome to all of you.
Thank you.
Thank you.
Let me start just by asking each of you overall what your thinking is of what the government's put out there on the table today. Catherine in Sydney first.
Well, we're prepared to be cautiously optimistic. I think anything that focuses on early intervention and prevention and supports young people, especially those who are most disadvantaged, to access employment, we think has to be a positive thing. But we also think that there is more that needs to be done.
And do you agree with what you see anecdotally with what the data says, that it's young people, young carers, young parents, students who are most likely to end up stuck long term?
Well, there we'd have to say that the federal government, and in this process, is only looking at the data that it has access to. So it's identifying young people accessing those payments. But actually, we would say that they're not necessarily the most disadvantaged young people, and perhaps the cohorts of young people that we should be providing the most support to. And some of that data might be held by state governments. For example, young people who are exiting the out-of-home care system or in contact with the justice system. The federal government doesn't have that data. They'll simply be showing up as young people on a youth allowance or a New Start payment. But these are young people who need the most support. So we think there's a little bit more to be done to identify the cohorts that need the most attention and most support because they're struggling with a number of issues.
Okay, Terese, what's your overall take on what you've heard today?
Oh, well, we're supportive of anything that is viewed as an investment, particularly for sole parents, because, gee, they've had a tough time of late. I suppose my concerns are that that there is also some mention of some budget savings. So I get really nervous when we talk about an investment, but there's also some savings. So when I was talking to mothers today, particularly putting out posts and asking for comments, when I asked them what they wanted the most, it was jobs, 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 and more jobs, because there's not a family who takes solace or is happy if their children are missing out or they feel that they've been left behind. So we certainly want the investment, but we don't want it to come at any further cost or hardship, especially for families that are raising children.
I'll come back to that point in a second about cost and hardship, but first let me bring Ara into the discussion. What was your overall take?
Carers Australia has spent some years seeking an investment in young carers. We know that the job they're doing is really important. We know that they often fail to complete their school. We know that they struggle in the job market. We want to see an investment in them, so we're quite excited about the possibilities that this new fund might raise for them. But we want to be very clear that young carers lead very complex lives. Their situations are often quite unique. They're often socially isolated. They have a lot of trouble in envisaging a life beyond caring, and their self-confidence is often dented. So any investment that we make must be aware of the complexity of their lives and must not add a stress to those lives, because what they're doing is incredibly important.
And also, if you can help them with those hurdles, they probably would be great employees because of the sort of resilience and empathy and whatnot they would have developed as carers, one would assume.
For many of them, they have dealt with issues far beyond their years. They're often dealing with issues like death and dying. They're dealing with complexities that other young people aren't dealing with. So they're able to do an extraordinary amount of things. But they're also really often affected by that. They're deprived of sleep. They're often in low-income families, often single-parent families, and they're often doing a lot more than other young people their age. They're dispensing medications, they're doing the household chores, they're dealing with authorities, and they're often dealing with very complex health situations at home.
There was a lot of talk today about jobs, and you mentioned, Terese, what people want is jobs. Anybody who works and juggles children or works with caring responsibilities knows that it is tiring and it's very challenging, and often the difficulty isn't necessarily doing your work at your job. It's actually just coping with what's going on at home at the same time, and that's incredibly exhausting. Isn't the situation at home where potentially government needs to look at providing some greater assistance if we're going to try to put more people into work, Terese?
Oh, well, absolutely, because if you're already living in financial hardship and you're one step away from becoming homeless, it is so hard then to concentrate on all the other bits and bobs that you need to keep the family together. So a sole parent, they make career compromises, they do all of the thinking, the planning, the nurturing, the parenting. There's not those two sets of hands. You need to predict, you need to plan. So the ideal is beyond just the job. It's a job that will actually work in with the needs of that particular family, and each family is slightly different. You might have some informal support, you might have that extra, the grandparents on standby, or you just may be very isolated. So one of the areas that we think that hasn't been spoken about a lot, and we didn't hear anything of it today, is families that have been impacted by domestic violence, that are particularly post-separation and trying to stay safe. So there's a lot of complexities around trying to give that hand up, and it should never come with a stick.
Let me ask Catherine for your take on this question of the balance between trying to get people into work but giving them sufficient support at home if they have caring responsibilities.
Well, I think it's essential. We know that early childhood education and childcare is a particular challenge, especially if somebody's trying to re-enter the workforce and they may only be able to access casual or irregular work. We want to support them make those first steps, but without making sure that we've got the right settings for access to reliable and good quality childcare. That can be really difficult for young parents trying to access employment as well.
We had on the show the other night Moana Hope, the Victorian woman football player who's fantastic, and she cares for her sister, and she outlined us an average day in her life, and it was just mind-blowing what she had to actually squeeze in. What sort of things do you think governments could do to help carers balance everything they have to do?
We need to find ways to make sure young carers are able to complete their education. So we've got to find ways to support them both in the home and both to complete their studies. So sometimes young carers can't complete their studies in the time frames allotted to them. They need extra time. They might not be able to turn up at exam times or complete assignments on time because there's been a crisis in the family. So we have to look at ways that we can be flexible in ensuring that we give them the assistance to get across the line, to complete a study and then to enter the workforce without adding the burden of trying to make them do it in a caring situation. So the caring situation might mean they need some extra support at home, which might help with activities of daily living. It won't help with the emotional support or the loving kindness that comes with family life, but it might help with some of those domestic tasks and some of those things that might free up a young carer to get on with their studies. So we need to look at every situation individually and work out how best to impact that family, how best that young carer can be freed up to get on with their education, and what supports they need to perhaps go back to that education.
Much more to discuss, but we're out of time, unfortunately. Cresswell, Terese Edwards and Catherine Yeomans, thank you so much for joining us.
Thank you.
Thank you.
Thank you.